Hey guys, welcome and welcome back to another video. So today's video we are going to talk about why vaginal dryness during sex. So guys, if you have not subscribed, please kindly subscribe, like the video, share, comment. Don't forget to turn your notification bell so that every time I post a video you will be the first person to be notified. So what is this vaginal dryness? We know most of the time women are the people who usually suffer vaginal dryness. And why vaginal dryness during sex, and what are the causes, what causes this vaginal dryness, and does it have any solution? So we are going to look at that in this video, so stay tuned. Make sure you watch this video up to the end, and don't forget to share it with your friend. Don't forget also to turn your notification bell. I've repeated it more than twice. So vaginal dryness is painful symptoms that affects a person's life quality, or the quality life of a woman, and it can cause it can it can cause pain during sitting, exercise, peeing, sexual intercourse. And one of the most noticed, or one of the most situation that people usually report is that it can cause pain during sex. That is what we want to talk about. And why will someone, or why would a woman experience vaginal dryness during sex? So let us look at the causes of vaginal dryness. Number one, breastfeeding. If you're breastfeeding, you are not ovulating. And if you're not ovulating, most of the time you will get that you are experiencing vaginal dryness. And during this time, you will experience pain during sex. So maybe before you can abstain, or you can avoid sexual intercourse during breastfeeding, so that you don't experience pain during sex. Another point is birth control. Those are using hormonal contraceptives. They usually suffer from vaginal dryness. Reason: this hormonal contraceptive, they usually interferes with your hormones. They usually interferes with your estrogen, and you know the estrogen are the one that are responsible for secretion that we usually get during our lifetime. So if estrogen has been reduced in your bloodstream, obviously you will suffer from vaginal dryness, and it will affect your sexual life. The next point is someone who is getting treatment, cancer treatment. Someone who is getting chemotherapy and hormonal therapy. This treatment usually interferes with your hormones, whereby they reduce the level of estrogen in your body, and you know the function of estrogen. They make your vagina healthy, and they make your vagina to secrete or to clean itself most of the time. So when this treatment, when you are getting this treatment, you will experience vaginal dryness, and you will feel pain during intercourse. The next point is diabetes. Diabetes is also one of the a condition that interferes with your hormones. It interferes with the blood supply to the various part of your body. So with this condition, you will experience it. Also reduce the libido. So if the libido is not there, of course you will experience the vaginal dryness during sex. We also have medications, such as those who are getting antidepressant, or those who are using antihistamine, those who are getting treatment of fibroids. Those people also can experience vaginal dryness during sex. Another thing is that the next point is ovarectomy. Ovarectomy is the removal of ovaries. We know the functions of ovaries. They produce hormones, estrogen and progesterone, which are responsible for ovulation and the menstrual cycle. And when these ovaries have been removed, you will not you will not have what? Estrogen, because you will not have the ovaries. So ovarectomy, it's also one of the cause if you are somebody who has gone for ovarectomy, especially those who have suffered ectopic pregnancy. If you don't know about ectopic pregnancy, you can Google. If you've suffered ectopic pregnancy twice, and you get and they removed the ovaries, you will also suffer from vaginal dryness. The next one is not being sexually aroused. Yes, if the foreplay is bad, that is also another cause that will also there's also what it is also another situation that will make you suffer from vaginal dryness. Also, those who are using scented soap, perfumes, spray to wash their vagina, you will end up suffering from vaginal dryness. Also, another group of people who are can suffer from the vaginal dryness is someone who is approaching menopause. When you are approaching menopause, your estrogen level reduced, and when estrogen level has been reduced, automatically you will suffer from vaginal dryness. As we know that vaginal dryness can cause some of the problem, let us look at some of this problem that this vaginal dryness can impact to a woman. Number one, we have burning and itching. You will feel that down there is burning, and you will also experience itching. You will experience bleeding during sex, or maybe you will notice it after sex. And also the vaginal wall tissue will break down. We have soreness in your vulva. You will experience soreness or a wound, yes, in your vulva. You can get recurrent UTI because the vagina is not cleaning itself. You know that when you are getting the discharge, it's when the vagina is cleaning itself. So most of the time you will suffer from urinary tract infection or yeast infection. Also, you will need to pee often. You will feel the need to pee often. Frequency and urgency will set in. Also, you will not get wet during sex, and the most problem that you will experience during sex is that you will not reach the orgasm. So is there something that can be done to prevent this? Yes, there are some of the things that can be done to prevent this thing that is called vaginal dryness. If you have diabetes, you can control it. If you're using hormonal contraceptive, you guys, if you don't know how to use natural family planning, can you DM me so that I can show you how to use natural family planning? So in short, I'm saying stop using those hormonal contraceptive because they interferes with your hormones. And apart from even experiencing this vaginal dryness that is bringing low libido, you can also get other medical conditions related to hormonal family planning. Also, another thing that if maybe you are approaching menopause, there are some lubricants that are scientifically proven that you can use to help you during intercourse. According to the course, you can also see your health provider to help you identify the cause so that you can be treated according to the cause. Yeah, maybe sometimes you are not even maybe sexually prepared. That is why you are experiencing this vaginal dryness during sex. But if there is any health condition that is causing it, you can see your healthcare provider, and the healthcare provider will help you to solve the problem. So I think I'm going to reach there. If you have not subscribed, kindly subscribe, like the video, share, comment. Don't forget to turn your notification bell so that why are you watching my content and you have not subscribed? You better stop watching if you don't want to subscribe. Yes, yeah. So make sure you subscribe, you like, you share, and also you comment. Stop watching. If you don't comment, it means that you have not learned anything. You have not learned anything, and our goal is that you get knowledge. Yes, you learn something from this platform. So comment so that I know where I go wrong, so that I help you. If you want to know how to use natural family planning, guys, I'm really requesting you, if you want to know how to use natural family planning, DM me. I will teach you this. Also, we have a video of how to use natural family planning, this calendar method. That is most of the, we also, as in, we have so many types of natural family planning, but the one which is in our sumbuanga, the one in our patianga problem, is this calendar method. So I'm willing to teach you for free. In fact, for free. And if you don't want me to teach you, I also have a video in this platform. You can go and watch it and rewatch it and rewatch it. If you have a question, you can ask. I will help you. Stop eating estrogen and progesterone. You will have heart problems. You will have cancer. You will have other conditions related to hormonal contraceptive. So stop using those things if you don't have to, if you don't want to get into these problems. Bye till next time. Let's meet in the next video.